Hello everyone, in this video I am going to tell you about appendicitis. For that to understand, we should know firstly what is appendix. So, the appendix is a tube or worm-like muscular thin pouch vestigial organ. Now, we will know the location of the appendix. The appendix located right lower quadrant of the abdomen. This is the shape of the appendix. The appendix is worm shaped, so appendix called many times vermiform appendix. This is worm shape. Size of appendix. The appendix is a worm-like extension of cecum. It is about 8 to 10 cm or its range is 2 to 20 cm in length. Thickness of appendix is 0.3 to 1 cm. Layers. In appendix, muscular membrane present. Here outer longitudinal and inner circular layer are present, and submucous layer also present in appendix. Position of appendix. According to the position, there are 5 types of appendix are commonly seen. These are retrocecal or retrocolic or 12 o'clock position, pelvic type or 4 o'clock position, subcecal paracolic or 11 o'clock position, splenic type or 1 or 2 o'clock position, promontoric type or 3 o'clock position. Now we will see the position of appendix through this diagram. This is the retrocecal appendix or 12 o'clock in position. This is the post-ileal or 1 o'clock in position. This is the pre-ileal or 2 o'clock in position. Post-ileal and pre-ileal, these two are in splenic type. This is promontoric type. This is promontoric type or 3 o'clock in position. This is the pelvic type or 4 o'clock in position. And lastly, this is the subcecal or 11 o'clock in position. Now we will know the most common appendix. Most common is retrocecal and second most common is pelvic type, and least common or most difficult to diagnose is post-ileal. Now we talk about the blood supply of appendix. The appendix supplied by the appendicular artery, which is the branch of ileocolic artery, branch of the superior mesenteric artery of the abdominal aorta. This is the ileocolic artery and this is the appendicular artery. Lymphatic drainage. The lymphatic drainage of the appendix occurs via the ileocolic lymph nodes. Nerve supply of the appendix. Sympathetic and parasympathetic nerves from the superior mesenteric plexus. An apparent nerve for pain accompany the sympathetic plexus, center the spinal cord at the level of 10 thoracic vertebra. Now we talk about the function of the appendix. As we know, the appendix is a vestigial organ, that means no function in human body. So technically, appendix has no function. Appendix acts as a storehouse for good bacteria and rebooting digestive system or immune system after diarrheal illness. So now we talk about appendicitis. Itis means inflammations. So appendicitis means inflammations of the appendix. Common cause of the appendicitis: lymphoid tissue hyperplasia. It is most common overall, about 60%, more common in young patients, and common cause in elderly patients about 30%. Second cause is fecalitis, and third other cause is foreign bodies, infections such as parasites, neoplasia such as carcinoid tumor or adenocarcinoma. Now we talk about what is lymphoid tissue hyperplasia. Lymphoids are increasing in number when then growth of lymphoid tissue occurs, then obstruction of appendix occurs, and lastly inflammation of appendix occurs. This is lymphoid tissue hyperplasia. What is fecalith? Fecalith is hardened fecal matter. Fecalith are the common cause of appendicitis in elderly patients. What are the signs of inflammation? Redness, swelling, heat and pain. Redness, rubor, tumor swelling, calor heat, dolor pain. Abdominal examination. Right lower quadrant pain, rebound tenderness and three classic signs. Three classic signs are Robson sign, Schwartz sign and obturator sign. What are the etiology of appendicitis? Picoli, such as food material and lymphoid hyperplasia. What are the types of appendicitis? There are two types of appendicitis, acute appendicitis and chronic appendicitis. Acute appendicitis. Acute appendicitis is most common surgical emergency of abdomen. Sign of the acute appendicitis: pyrexia, localized tenderness in rebound tenderness is positive. Maximum tenderness is present in McBurney's point. Maximum tenderness is present in McBurney's point. Special sign: pointing sign, rebound tenderness, Robson signs, Schwartz signs and obturator signs. So, pointing sign. What is pointing sign? What do you mean by pointing signs? So, pain was started first day around the umbilicus, then shifted to the right iliac fossa. Rebound tenderness. Pain is felt in McBurney's point, so rebound tenderness is positive. Robson signs refer pain to the lower right quadrant of the lower left quadrant. Schwartz signs: patients will be felt lateral position on extension or flexion of the right hip joint, while abducted position pain will increase. Obturator sign: on flexion of hip joint and external rotation of hip or right thigh flexion, pain will be increased. This is called obturator sign. So, special signs. In special signs, there are 5 signs present: pointing sign, rebound tenderness, Robson signs, Schwartz signs and obturator signs. What are the symptoms of acute appendix? Firstly, lower abdominal pain, at first in periumbilical region, then pain shifted to right iliac fossa. Pain is present in 80% cases. Anorexia, nausea, vomiting may also present with indigestion, discomfort and fluctuous diarrhea, etc. What are the clinical features of acute appendicitis? In sex, male more than female and age in the range 20 to 40 years. Pathophysiology of acute appendicitis. Due to obstruction in the lumen of appendix, the obstruction may occur due to food materials, lymphoid hyperplasia, addition lymphoid plasia, etc. And due to continuous mucus secretion, there will be increased intraluminal pressure. This pressure will compromise vascular supply and causes bacteria. What are the risk group for perforation for appendicitis? Elderly people, immune-compromised patients, Picoli obstructions, pelvic appendix, previous abdominal surgery. Classification: morphologically non-obstructive, acute obstructive, and clinically acute and recurrent. Causes of acute appendicitis: in the lumen, Picoli and intestinal parasites, and in the wall, lymphoid hyperplasia, carcinoid tumor, compression by the bands and adhesion. Clinical picture and diagnostics: pain, vomiting, fever, nausea, weakness, malaise, loss of appetite. Firstly pain, then vomiting, then fever. This is called Murphy triad. Patient prefer to lie on the right side with rotation of the left then increases in pain. This is called Sitkovsky's signs. Talk about treatment of acute appendicitis. In general treatment, osmolar serum regimen and vital blood pressure, pulse rate, etc. Specific treatment: appendectomy, either open or laparoscopy.